Imagine getting a deep cut today. You might go to a hospital, get stitches, antibiotics, pain medicine, and walk out knowing someone can help you. Now imagine getting that same injury 5,000 years ago. No hospital, no antibiotics, no x-ray, no ambulance. So how did ancient people survive? The surprising answer is that they didn't simply do nothing. They developed their own forms of medicine, using plants, herbs, wound cleaning, splints, surgery, and generations of accumulated knowledge. But there was a brutal reality. Sometimes their treatment worked, sometimes it didn't. And sometimes a simple infection could turn a small injury into a life-threatening problem. So how did humans survive long enough to build civilizations without modern hospitals? Let's go back to the beginning. Before doctors existed, humans had something extremely important: observation. People noticed that certain plants helped wounds. Some foods made them feel better, and some treatments reduced pain. Imagine an ancient hunter getting injured. His community couldn't search Google for an answer. Instead, they relied on experience. Someone might remember, last time we used this plant on a wound, it helped. That knowledge could then be passed from one generation to another. Over thousands of years, this created a primitive medical library, stored entirely inside people's memories. Some knowledge was probably useful, some was probably completely wrong, and there was no scientific laboratory to separate the two. But through observation, experimentation, and tradition, ancient communities slowly developed surprisingly sophisticated medical practices. So who actually treated sick and injured people? Different cultures had different specialists. There were healers, midwives, herbalists, surgeons, religious practitioners, and people who simply had extensive experience treating injuries. A skilled healer could become extremely important to a community. They might know how to stop bleeding, set broken bones, assist during childbirth, or prepare medicinal plants, and some ancient societies even had written medical records. In ancient Egypt, for example, medical knowledge was recorded on papyri. These documents described injuries and treatments, showing that ancient medicine wasn't simply random superstition. People were recording what they observed. But their understanding of the human body was still extremely limited compared with modern medicine. They could treat what they could see. The invisible world of bacteria and viruses was still completely unknown. One of the biggest dangers in ancient life wasn't necessarily the original injury. It was infection. A cut could become contaminated and develop into a serious illness. Ancient people used different methods to deal with wounds. They could clean injuries, cover them with dressings, use plant-based substances, and apply pressure to control bleeding. Some ancient medical traditions also used substances that may have had useful antimicrobial properties. But remember, they didn't understand bacteria. They didn't know why some wounds healed while others became deadly. They were essentially fighting an invisible enemy without knowing its name, and that made every serious injury a gamble. Now imagine breaking your leg thousands of years ago. There was no orthopedic surgeon, no modern cast, no physiotherapy clinic. Yet ancient people did know something incredibly important. A broken bone needs support. They used splints and other methods to stabilize injured limbs. Communities could help injured people remain still while their bodies healed naturally. And bones found by archaeologists sometimes show evidence of healing after serious injuries. That means some ancient people survived injuries that could have been devastating. But survival didn't always mean a perfect recovery. A badly healed fracture could leave someone with chronic pain, limited movement, or a permanent disability. So ancient medicine wasn't necessarily about making someone completely healthy. Sometimes it was simply about helping the body survive. Here's where the story gets surprising. Ancient humans performed surgery. Archaeologists have discovered skulls showing evidence of a procedure called trepanation, where a hole was intentionally made in the skull. Why? The exact reasons varied and aren't always known. It may have been connected to injuries, medical conditions, or cultural beliefs. And here's the incredible part. Some ancient skulls show signs that the person survived the procedure because bone began healing around the opening. But don't imagine a modern operating room. There were no modern anesthetics, sterile surgical theaters, antibiotics, or advanced monitoring equipment. Surgery was dangerous, extremely dangerous. Yet humans were already experimenting with ways to repair the body thousands of years before modern hospitals existed.